Welcome, everyone. We are so glad you're with us today on this Monday. Suzanne Stell, Executive Director of Shelton, and we have missed you to say the least. We hope this town hall finds your family doing well, finds your family having time to renew and refresh and have more fun together, but we also hope you're staying well and healthy. We can't say how much we've missed you, that is for sure, but we're excited we at least get to Zoom with you today and give you some information that's going on. As you can imagine, we have been changing course by the week, but we want you to feel assured that we are ready and continue to change course whenever needed. I'd like to make a special welcome to our new families who are joining us today. Never dreamed a year ago you would be joining virtually, but you are, and we're thrilled you're with us. Today is our town hall for EC through 5th grade. We have broken up our different divisions by age, by families, due to so many different questions that families may have, and the information's a little different. First of all, what I'd like to do is introduce some people you will be hearing from today. You will be hearing from Amy Kelton, who is our upper school head, also associate head of school, Christine Davis, head of lower school. You will be hearing from Chris Brindell, technology expert. Thank you, Chris, and our entire technology team. You will be hearing from Eve Herman, our wonderful nurse. As you can imagine, she's been very busy too. And I think you will also be hearing from Melanie Barnett, associate head. She's going to be moderator for us when we have questions from you. So we've got the team here. I can't do this job at Shelton without our team, and I can tell you our team has not taken a break since March 12th. Our teachers are continuing to work all summer on whatever plan we go with for our students, and we want to guarantee to you that we are striving hard to do everything possible to blend a high quality education with the safety and health of our children. I will tell you that this time last week, it was a different plan. But with the news coming out on Thursday, as you all heard, about public schools and private schools, we had to change course very quickly, but we were ready because we knew that could happen. I will tell you, as we are talking right now, we are anticipating even more news coming out. So we realize that when news comes out, that's why we don't react quickly, because it takes about a week to sort out who has said the right information, who it's coming from, if there will be changes in the information. So please know we realize all of that. Everything you're hearing today is in draft form because we know we can still change course because of everything being dynamic and ever changing. But we're trying to be transparent with you so that you know what our anticipated plans are. Procedures for questions. Please type them in now. Chris, do they need to know anything else about the questions? We know we will not have time for all questions at the end, but please know we will have your questions recorded and we will get back to all the questions, because our goal is to make sure everybody knows the information they need to know to the best of our ability. But we will have time at the end to answer some questions, and that's why Melanie will be our moderator. Chris, do they need to know anything else?
The only thing is, depending on the device that you're connected on, if you are on a mobile device, Q&A button might be at the top right-hand corner. If you're connecting through a computer, then the Q&A button is probably at the bottom. The dock will rise up if you move your cursor. So in the top right or somewhere along the bottom, you should see your Q&A button.
Thank you, Chris. I also want to say thank you to you as parents. You have done an amazing job. March, April, May, we have been so impressed with what you've done at home, and we know it has not been easy with this age group. We're very aware of that. But what you have done and partner with us, we can't say thank you enough. And also, we want to say thank you for your support, your overwhelming support of our teachers, of our administrators, of our entire Shelton community. We felt the partnership with you, and we want you to know that we are thankful for your partnership. We heard you loud and clear. You did the parent survey in the middle of a surge. You can see that at that time, 86% of families want their children back at Shelton. 14% want to do at-home learning, and that's why we are offering both platforms. Many schools can't offer both platforms. We are able to, and we'll tell you more about it. We also very much appreciated all your comments, your suggestions, and your questions. So from your survey is how we developed our information today for you to hear. We realize that you may change your mind. We're all human. We will do another survey August 3rd week so that you can tell us again how you're feeling and what you think. This is probably what you're wanting to know. You will see in red at the top, draft. Possibilities for starting school. Please know this is what we're hopeful for, but it could change as we're talking right now. August 24th week, with construction and governmental agencies permitting, we are hoping to still have small groups of students and parents on our campus so that they can be introduced to their advisor. And also we know that many of you will want to see our new building. Not many people are building a new campus in the middle of the pandemic, but we are, and we'll be stronger for it, that's for sure. So we're hoping this can still take place. If not, you know how we do it. We've done it a lot. The drive-through for supplies and the drive-through for laptops. But with even the information we have now from last Thursday, it looks like we can have some small groups on campus. And please know we will do this with all safety and health protocols in place. We will have a sign-up genius. We have it all planned out, very detailed, multiple families over multiple divisions, over multiple days that week is how we have it planned. So you will get more information on that, but we're so hopeful we can do this because the children need to see their advisor. They need to meet them. We know how important that is. Then we will go to Shelton at Home until after Labor Day. We will start off with all groups with a home learning boot camp. Again, if we can have any groups on campus to learn some of that, we will. But at this point, these are our plans. After Labor Day, this is what we are hopeful for. EC through 5th grade on campus every day. That's you. We know our children need to be on campus every day. And if health department and if everybody is in line with this, then this is the way we're going. Hybrid schedule will be for our 6th through 12th graders. That is not you today, but I just wanted you to know that they're giving up some days so that we can have our little ones on campus because that's how they learn. And so we will be dividing our middle school and high school into hybrid groups for a couple of weeks for a safe and careful start. Then our hope and dream is to have everybody on campus September 21st week. Again, all draft. You know the 3 different plans we're looking at: Shelton on campus, Shelton at home, Shelton hybrid. What involves you, EC through 5th grade, is Shelton on campus and Shelton at home. It's going to look different than it did in the spring, and Amy and Christine will be covering some of that with you at the end of this slideshow. Want you to know what we're doing. We have different teams working all summer, different teacher groups. You're going to get some of this information when we send all this home to you on Thursday. You will see all the different things we're looking at, even if we have to be at home with this age group, EC through 5th, especially with the reading, writing, and math. We heard you. We're listening. Your parent feedback, consistency of our platform, simplify our communication, consistent time with teachers, and the emotional and social support. We've got a plan. We also have a plan for new technology in our classrooms. Our EC through 2nd graders will have a document camera so that they can record. They're already working on it. They've been working on it since spring and all summer to record specific lessons for our students if we have to be home. For our 3rd, 4th, and 5th graders, they're also going to have the document camera and a Mevo camera and in the classrooms. And the reason they have the camera also is because the teacher does some things as a group. With our little ones, we don't do as much group teaching. It's more individualized. We're very excited about this technology technology, and it's thanks to a grant from the Moody Foundation, or we would have never been able to do all this. Now I'm going to turn it over to Chris Brendel to tell you a little bit about EC through 5th grade platforms.
Good afternoon, everybody. Thank you for joining us. My name is Chris Brendel. I am part of the technology department, and we're going to talk about some of the technology and then some of the platforms that we're going to be utilizing this year for both EC through 2nd and 3rd through 5th. So as you can see, for our early childhood through 2nd grade classes, we're going to be using the Seesaw platform. It is a learning management system, LMS for short. Every class is going to be using this. We had 2 teachers, Lisa Winkler and Christina Rosen, pilot this back in the spring. And this will become you and your students' learning hub. So all of their assignments, all of their activities, their works and announcements will all be posted here in a central location. It will be accessible from any internet connected device, whether that be a computer, a Chromebook, a Dell laptop, a MacBook, even mobile devices such as iPads, tablets, and even phones. So we do have some recommended technology. These are completely optional. There's a QR code here that you can access very quickly. I will go ahead and open it up just so that you get an idea of what it is. So again, this is optional hardware, accessories, and apps. The apps below are broken down by grade level, but the rest of this stuff is applicable for any age group. So again, that QR code, and when we send this presentation out, you'll have access to that QR code, and it is a clickable link as well once you're inside the presentation. So for our grades 3rd through 5th, actually all the way up through 12th, but for 3rd through 5th, we'll also be using Google Classroom. So similar to Seesaw, this is the Classroom hub. Assignments and homework and notes and all of those things will be posted there. And teachers, when they give assignments with due dates, now 3rd through 5th is a little bit different than 6th through 12th. We recognize that, but teachers will be utilizing due dates simply to allow those assignments to automatically be posted to the Google Calendar. So please do not think that we're changing anything up as far as academics are concerned. The due dates are simply to be able to utilize the Google Calendar, and the teachers will be communicating that with you later on. Just like Seesaw, any internet connected device can be used to access Google Classroom. For both Seesaw and Google Classroom, if you happen to have a tablet, that is a fantastic way to use both of these platforms. Zoom versus Google Meet. This has kind of been a big talking point within Shelton. And as of right now, to try and help the progression to the new school year for our staff, we are going to allow teachers who were using Zoom previously to continue to use Zoom to start the year off. At some point, right now, the plan is November 30th, December 1st. So after Thanksgiving, we are hoping that all of our teachers, EC through 12th, will move exclusively to Google Meet. So there's not going to be a big change as far as that's concerned for teachers and students. But that is something that we're going to be working towards. One of the biggest issues that we heard about was emailing out links and just kind of having an inconsistent platform for posting these various video conferencing links. And so for all grade levels, EC through 12th, these Google Meets and these Zoom links will be posted within the appropriate LMS. So EC through 2nd, it will be posted in Seesaw. For 3rd through 5th, it will be posted in Google Classroom. So some of the technology that Suzanne mentioned through the grant with the Moody Foundation includes for every instructional teacher, EC through 12th, we will be able to issue an iPad for use in class as well as remote learning should the need arise. This will allow lower school teachers specifically to have an easy way to communicate and stream with their students who may be at home during this learning process. So they could stream celebrations of life, they could stream their morning programs, so pretty much anything through Zoom or through the Google Meet. With the use of that iPad and a special stand, they'll be able to live stream with the students at home. Additionally, for any teacher, regardless of grade level, this can be used as a document camera. So teachers would be able to demonstrate their works. Students would be able to demonstrate their works as well. General concepts, and additionally within a science classroom, they could be able to live stream labs. In addition to all of that, we'll be able to have teachers create one-on-one lessons and small group small group instruction using these iPads. So then third through 12th, but third through fifth will also have a Mevo Start camera in the classroom. This is completely controlled by the teacher. It is up to the teacher's discretion when it's on and when it's off. But it will live stream to an unlisted teacher's YouTube channel. So these are unsearchable. You cannot get onto YouTube and be able to look up and try and find these channels or these videos. So they are, for all intents and purposes, hidden from the general public. The teachers will share this link out to their unlisted YouTube channel with you, the parent, as well as the student through the Seesaw app or through the, not through the Seesaw app, simply through Google Classroom, because EC won't have these. EC through second won't have these. Students' faces will not be on camera, so the teacher will position this towards the back of the classroom so that it only sees the back of heads, if any heads at all. And then the videos, the previously broadcasted videos, will be available for students on demand for reteaching, reviewing, or even tutoring purposes. So then I have a short video, it's about 1 minute long, kind of showcasing some of the features of this Mevo Start camera. So one of the new things that we're going to do this school year is actually offer parent trainings. So we've been hard at work getting all of our teachers prepared, and they've done a lot of work themselves and doing trainings throughout this summer when the time is theirs to be off. So they've been working very hard, and we want to extend this opportunity to parents as well. So we will be offering live and on-demand webinars for all of our parents, EC through 12th. There's 2 QR codes here. These links will be shared out once again later on. So if you don't get to it right now, you'll have an opportunity to later. But you can sign up for these webinars, very similar to the format we're in right now. The webinars will also be recorded and posted online so that you can view those at your discretion. And I will also, I've already created some, but will continue to create additional support documents for the various platforms that we use. So the first QR is to be able to sign up for these trainings. The second QR is to be able to access the website where these support documents will be located. These are the current topics and dates that are going to be offered. There is likely more to come. So if any of these don't fit your schedule, hopefully we'll have some maybe during the lunch break time to where you can connect and get some of this information as well. So 2 sessions for Seesaw, Google Classroom, and Google Suite overview. Google Suite is basically going to focus primarily on Google Drive, Google Calendar, Google Docs, and Google Slides. And that is all that we have from technology, so I'll hand it back over to Suzanne. Thank you very much.
Thank you, Chris, for all the work our entire technology group has done forever. One question you might have as a parent. So if I choose distance learning, Shelton at home, what does it look like for my child? You will be hearing those details from Christine and Amy, and we're developing a lot of those details too. But the other question you will ask yourself is, what if I choose at-home learning and then I change my mind? Well, we're fortunate at Shelton, we get to be flexible. All we're asking families is that we have a one week notice. And the reason for that 1 week notice is just making sure we have lab supplies, all the materials ready, Montessori equipment, anything we need in EC through 5th grade for your child. So we have that flexibility, but I know that would be a question for some of the families that want to choose at-home learning and think they want to change their mind when they feel more comfortable. Absolutely. You can do that with just 1 week notice is all we ask. So most important part is health and safety of your children and our staff. We sent out a lot of information in July. So please know that we're not going to go over all of those details because it is on our website. And please always refer to it if you need to. We will also be putting a lot more frequently asked questions on our website too, so that you will always have that those questions and answers available. We're going to hit some of the key points today. You can see, and I won't read the list, you can read it. I think we are very fortunate because we can spread out over 30 acres. For you to know, we have 7.5 acres of building space. You know, it's been a challenge building a new campus in the middle of a pandemic, but we're very thankful for it, for the reason of space, there's no doubt. The other areas, outdoor hand washing station. I was over at the new building one day, I looked around, saw the outdoor hand washing stations that our construction crew is using, and I said, can we have those all over? And they said, absolutely. So we're thrilled about that. And also isolation rooms in our clinic. We had already planned for that on our new campus, but we will have that. And it's very important in times like this. For you to know, everything that we are putting thought into the pandemic, we're also putting thought into continuing the use of it after we get out of all this, which we absolutely will. Physical distancing, I just talked about that a little bit. We will be spreading out. We already have small teacher-student ratios, so we already fit the protocols and the health standards with 6 feet apart. Our furniture design team has helped us tremendously. You know, a 3, 4, and 5-year-old, they don't know space. You see all the children in the neighborhood every afternoon. Social distancing is very challenging for them. So we absolutely know that, and our design team has drawn up room arrangements to help us with that so that our children will know their area. Mask and face shields, what a topic. Yes, we want them 1st through 12th grade. And as many of you already know, we meet with many different task forces. We've met with them since March 12th. We continue meeting with them. And one is medical doctors. And one of the doctors on our medical group represents 18 pediatricians, which is very helpful to us. And between hand washing, social distancing, and face mask, we know that will help mitigate the risk of the virus. So yes, we will be asking for face coverings. Please have some fun with this. We've got to have some fun as we go through this together. But please, if your child has a favorite character or favorite something, figure out the material that your child would like and have them made in that material. We also sent a link in our previous communication that has a lot of masks. And a lot of colorful ones. We're not going with the same one because we realize as adults, we get used to one that's comfortable for us, but it may not be comfortable for you. And we realize that. So please use that link in our previous communication. We do suggest you do this now though. We will always have extras for children. Don't worry, we understand that. We live in this world. ADD, ADHD, sometimes we forget. We got it. And we'll have everyone covered. We will have flexibility allowed. We have children with developmental situations, with sensory issues. We're gonna work with even our little bitties. We've got our 3, 4, and 5-year-olds. If they can wear them on their way in and on their way out, fantastic. One thing you will know with face shields is that all different groups have a different age. We're starting with our 1st and 2nd. Governmental agencies say 10, CDC says 2. So we're in the middle and we realize that. Anyway, please do go ahead and order them and let your child have some input with those, but we'll be very flexible with them in situations that require that. We don't want them fearful of them. We'll also send videos so that they can see their teachers before the first day of school if we don't get to meet them. So anyway, we just appreciate your support in that. We will be supplying, we have a parent who is personally making a face covering for all students at Shelton cloth. And we also will be purchasing face shields. Some of our students will find that a lot more comfortable. And also our teachers, for you all that are concerned that students can't see their teachers' mouths. That's why we're doing that, is so our children can see our teacher. They can see us smile. They can see us communicate with them. Screenings. Yes, you will be doing a daily symptom check. We're finalizing the app as we speak. Temperature checks. This is the one thing everyone is in consensus about, is that it could lead to a false sense of security. We are still considering it, but we are definitely listening to everyone. So just for you to know that. We understand for parent comfort, that may be the reason we're doing it. We realize that a child could be on Advil and Tylenol for whatever reason, and their temperature shows up okay. We can't be in control of all of that. So the most important part is your partnership with us and making sure children stay home with any symptoms of anything that could possibly be the virus. We will all have to trust each other. That's going to be the best safety and health for our entire community. So that's very important to us, but we were also continuing to gather information on the temperature checks. We're ready if we go that way. Visitors on campus, please understand that we will be limiting visitors on campus. I think the hardest part for parents will be carpool. Yes, we've been lax in those areas, but we just can't be, especially at the beginning of the year. We're going to have everyone staying in their car, and only essential visitors will be allowed on campus. It will help us tremendously, very much. We will be asking you for 24-hour notice for any scheduled appointments, because we're going to have staff involved in all of this, and it just gives us notice and we're ready. For you to know, this is very important to us. We have almost 100% new HVAC system. High efficiency MERV 13 filters are in place. The EPA recommends MERV 8 for schools. We are thrilled with this. And many of these areas, for you to know, have a pre-filter before the real filter. And the next highest grade is for hospitals. So another advantage of a new campus. You heard about the cameras that Chris talked about. We also have a whole new video security system being put in place. When I called our group, I said, I've heard that some schools are just buying video security cameras for contact tracing. And they said, absolutely. I said, will our cameras be able to do all of this? And they said, absolutely. So this is another area, wherever our cameras are, that if a child comes down with the virus or close contacts, we can look at our powerful cameras and figure out where the child has been and figure out who we need to contact, especially in those areas that are hard to figure out. Passing period, larger areas, outside areas, any place like that. So we're excited about that. Occupancy counting, it will help us identify high traffic areas and also high touch areas for cleaning. Now Eve will go over all of our health protocols.
Hello, everyone. Again, I'm Eve. I'm the coordinator for health services, i.e. school nurse, for the entire school. I have a wonderful helper, Lisa Nagid, who will be critical in helping keeping your children safe throughout this challenging school year we have ahead. As Suzanne said, our ultimate goal is to keep everybody safe. We will appreciate your understanding. We are going to err on the side of caution when it comes to sending kids home or keeping kids home, because there's just so much that is unknown about this virus right now, and we just don't want to take any chances. What you see before you, we will send home later if you want a copy of it, but this is a decision tree that was sent out by the Dallas County Department of Health and Human Services, and it really helps simplify and I think clear up some confusion. I've gotten lots of calls and emails about how many days for this and how many days for that. It is all very confusing. So this will help clarify that a little bit. So on the left-hand side is the positive COVID or suspected COVID, and the right-hand side is the close contacts or exposure to COVID. The big thing to notice is if you have a positive COVID or suspected COVID, there are 3 criteria that either the staff or the child, whoever is positive, needs to meet before being able to return to school. It is fever-free for at least 72 hours off of medicine. It is improvement in symptoms, particularly cough, and at least 10 days from the onset of symptoms. If a child is, whoever is diagnosed with COVID by a test and they've never had symptoms, they still need to wait the 10 days from the date of the test, not the date you got the results back, but from the date the test was done. The 14 days comes in if you were a contact of someone with COVID-19, that's on the right side. You will need to stay home for the full 14 days after the diagnosis of the person with COVID. So you probably, or hopefully, have all this memorized by now. You should have seen it many times, but the symptoms of COVID are unfortunately the same as many other things, which is why I'm asking your patience in if we're sending lots of kids home for things that we normally would not have in the past. Cough, headache, sudden loss of taste and smell, shortness of breath, significant muscle pain or ache, sore throat, diarrhea, chills, and a temperature over 100.0 degrees. Okay, this is where it gets a little tricky. If your child have symptoms that are COVID, we ask that you take your child to see a healthcare provider. It can be by telemedicine or whatever way your healthcare provider chooses to do so. If your healthcare provider determines that your child does not have COVID, we will require a note from that healthcare provider. And they can fax it to me at the number there. And again, we will provide you this number later. You don't need to rush to write it down. And then the child will need to be 72 hours symptom-free before they can return to school. And again, we're just trying to keep everybody safe. We just want to make sure nothing else shows up unexpectedly, is why we're doing this. And if you choose not to see a healthcare provider, which is certainly your option, we will enforce the same rules as if the child does have COVID, which I already reviewed. This is another area that is a little bit confusing and also is changing or has changed as of today. According to the CDC and the Dallas County Department of Health, a close contact is defined as anyone that's been within 6 feet of a confirmed case of COVID for at least 15 minutes or more, with or without a mask. So that's how we're defining a close contact. At this point, it's going to be an individual decision about whether to send home a whole class or send home just a few of the students in the class, depending on what that class looks like. I get a lot of questions about that, and I can't give you a yes or no. Yes, we will automatically send the whole class home, or no, we won't. We will not, when I send a student home from school, will not automatically make the whole class stay home until we know for sure that it is a case of COVID. Otherwise, people would be out of school. The doctors are expecting a very challenging fall and winter with flu and all the other regular illnesses that we get every year. So the doctors asked me to encourage you to get yourselves and your children the flu vaccine as soon as possible in order to help try to decrease the number of students and staff and everyone that gets sick this fall. We will be putting in a secure place on the website. We will be keeping track of our cases at Shelton by logging into the RenWeb or fax parent portal. You will have access to that site. So if you want to know what's going on, we will be keeping that updated. Obviously, if your child is in a class that needs to be quarantined, we will obviously let you know about that. And we will definitely not be giving out any names of students or staff that are infected to maintain confidentiality. I've been getting a lot of questions about this. If you travel to the United States, you do not need to quarantine upon your return to Dallas. But if you travel to any of the few countries that are still allowing us to travel there, i.e. Mexico, and I think there's a few others, you will need to, at this point anyway, quarantine for 14 days upon your return. And I'm gonna turn it back over to Suzanne.
Thank you, Eve. This year for attendance, we're going to ask for your partnership again and ask you to use these emails if you have a child who has any symptoms of anything. It's going to help us for this year and other years too. Yes, you can let the advisor know. Yes, you can let whoever else you want to know, but for sure, do it to this email. And of course, like everyone said, you'll be getting all this information. You don't have to remember any of this. You will be given everything to do. This will help us because once we understand what's going on, then we have to make the phone call to you. Eve has to know, then we need to have the time frame, 10 days, 14 days. What do we need to know? So all of that's going to be, we're going to be tracking very closely. And so going into one system per division is going to help us tremendously. Now, what we're going to do is have Amy and Christine go over some of the questions that they saw from your survey that you filled out.
Okay, so first to just introduce myself to you again, I'm Amy Kelton. I am head of upper elementary, 3rd through 5th, and joining me is my partner in this presentation. Go ahead and introduce yourself.
Hello there, Christine Davis, head of lower school, early childhood through 2nd.
Excellent. Okay, we're ready for the next slide. So the responses were incredible. Out of 186 total responses, you can see how those parsoned out amongst the grade levels. So we really appreciate you providing us this feedback because it helped us then activate and get started on some plans for meeting your needs as much as meeting the student needs. So on the next slide, you'll see how that is going to be paired out. So first of all, lots of questions about face masks. Suzanne already went over this, but we are requiring 1st through 5th graders to wear face masks. The school is providing one, but of course we would love if you would purchase some for this child to bring to campus. They do need to be washed each day, and so having a rotation is going to be very helpful. We were gifted with the ability to afford and provide every student and every staff member face mask and face shields. That's pretty unheard of for a school to be able to do that, but with a generous gift, we were able to do that. As you can see, EC and PP are encouraged, especially entering and exiting the building. Face coverings will be worn anytime social distancing cannot be maintained, but in those opportunities where we have social distancing in place, or we are outside, we will take a mask break for some of the students. Of course, the flexibility for students who are much, much younger and have difficulty having that on their face, or those with sensory challenges. We recognize that our kids, a concomitant thing that goes with children with learning differences are their sensory challenges. And we recognize that. So we will take into consideration factors with that. This was mentioned by Suzanne also, so we will be doing a daily symptom check, and you will have some technology in place in order to let us know what the daily symptom check is for your child upon entering. Staff members will also be doing the same. And the next slide. I love moving to a new campus for many reasons. Not only are the sanitizing stations going to be new and improved with the outdoor sanitizing stations, but also the in the building, hands-free in the bathrooms or touch-free sinks and toilets. We'll also be training in proper hand washing. But how great is it to have an M13 filter system? Something that is one step shy of what hospitals have. This is what the new campus afforded us. In the next slide. And then what does that Shelton at-home option look like? So we wanted to be able to provide something that was recommended not only by TEA, but also part of your parent feedback, which is when and if we can't be in school, which you saw when we can be in school. Starting September 8th is our proposed time in which we can be in school. But for those who continue to choose at-home learning, be able to offer both of those options. That's where the Mevo Start comes into play. The Mevo Start or the iPad at EC through Second is to be able to simulate as much real time for the student at home as what the students at school are getting. The at-home model is really to keep that student engaged. We are going to be pushing out schedules to you of what that would look like. A lot of this is in flux right now and to be determined based upon what each day presents itself, but never fear, we've been working on this for a long time and have those schedules in place. And then at the end of the spring, you are asked to take a survey about how at-home learning went with you, or e-distance learning. We have compiled that information, and as Suzanne stated, teachers have been going through a lot of training on their own time to improve the technology aspect, and then also improve what we are able to offer as far as non-negotiables. And that non-negotiable is reading therapy every day, math every day, and written expression every day. And that's when a schedule comes in place, whether you are at home learning by choice or we are at home learning through a government shutdown or what has been recommended to us. Those are our three non-negotiables, and that integrates with a teacher instructing. So we are going to provide more interactive experiences, and we really do appreciate your feedback on that survey because it sent us in a really good direction for our summer teacher training. And then what is a cohort? Well, thankfully for early childhood through 4th and even 5th, this was something we already really had in place. Cohorts are something new to those who don't have Montessori as part of their instruction. So when you go from class to class, that is the antithesis of a cohort. That means that each child is traveling to a different subject teacher and with different students in those classes. What we needed to be aware of, and cohort is one of those new terms that comes out of COVID, and here's another one, contact tracing is another term that comes out of COVID. We needed to add the security of contact tracing. And a cohort would provide that security, which means a child is no longer going from class to class. They are receiving their instruction within a group of students. The grouping for that, as you can see below, is going to be first and foremost, if your child is in the 2nd year of their 2-year cycle in the Montessori classrooms, EC through 4th, they will get to stay with the teacher they had last year. The cohorts will also be determined by what grade level your child is in, so we won't have any 3rd graders in a 5th grade cohort or any 1st graders in a 3rd grade cohort. It's going to look similar to last year in the 1st, 2nd, 3rd, 4th, and then 5th grade separated out. For 5th grade, I'd like to speak to that because 5th graders did travel some. They traveled for their reading therapy, they traveled for their math, and their science and social studies are what we call cultural. Instead, they will be grouped together in a cohort, and 2 teachers, both based upon strengths, will be teaching that cohort. So there's 2 cohorts, one of 10 here, one of 10 here. This teacher's strength may be in all of the reading therapies, and this teacher may be in math and science. And so those 2 teachers will be teaching those 2 cohort children. but all the cohorts are going to be grouped by the reading therapy method that the teachers have as part of their training.
Okay, plans for social distancing. Amy just spoke to the cohorts. No large group gatherings, and that's included at Carpool. And specifically designed classroom spaces for social distancing. We were so fortunate in a new building to have our furniture designer assist us with plans for our rooms for social distancing. We are obviously aware of developmental age and stage and what that means for social distancing for certain groups. As always at Shelton, we're individualized, we're flexible, and we recognize that. We do have plans in place for social distancing. Will materials be shared? Students, materials will not be shared. That's the simple answer to that question. We are fortunate to have made plans in the classroom for classroom materials, to have individual materials for each student, such as pencils, scissors, those kinds of daily supplies that are needed in the classroom. With the Montessori materials, students will disinfect hands before using the Montessori materials, and the Montessori materials will be disinfected as well. In regards to specials, those specials classes will also have individual supplies for students. And then upper elementary laptops will be used individually and disinfected after use as well. What is the plan for lunches? One of the favorite things at Shelton, we have amazing lunch with Sage and will continue to do so. This may include box lunches with prepackaged items or plated meals. We always have plans for students with food allergies or sensitivities and any kind of special dietary needs. Students will eat in their classroom or could spread out on our beautiful campus. We have opportunities for outdoor dining on our new campus. And students are also, if they'd like to bring their own lunch as well, that's always an option. Carpool. We will, again, not have large gathering areas for carpool. Parents are required to maintain the cars during drop-off and pickup. We're going to ask that the younger student to start practicing. We obviously will still help, but we want to practice with those car seats if we can for that little bit older student to be practicing buckling and unbuckling. It's a good skill to have, a good practical life skill to have. In the morning, there will be safety procedures. We'll be cleaning our hands and have our mask on and entry and exit to their buildings. And students will go directly to their advisory and cohort. And for the most part, that is not too far off from what we usually do in lower school and upper elementary. In the afternoon, students will be called into small groups as cars arrive, and the students will remain in their advisory room until their name is called. And we actually had initiated some of this in the spring as well, so we've already had a dry run through this. Will there be aftercare? We will offer aftercare. Logistics are being worked through. We want to continue to maintain our small group for social distancing and our structured schedule for this time in aftercare. So that is being very well thought through. And we hope to have at some point after school clubs or other activities, and that will just be dependent as information continues to roll out. A survey will be coming August 3rd regarding aftercare on campus or at home learning. The question is too, if I choose Shelton at home and I would like to be back on campus, if you'll just give us a week notice, if you'll notify your division office, division head or assistant head, or the admin in that office, and just let them know, the word will spread. We'll make sure someone gets in contact with you. The reason that we'd like that week is so that we can be prepared and thoughtful for your students' arrival back on campus, or if we're making an adjustment from on campus to at home, that again, that we have done that in a way that's thoughtful and everyone is prepared for that transition. We miss you so very much. Like I said, and like Suzanne said, we're a strong team. We have been working throughout the spring and summer. I will tell you the cohesiveness of your administrative team, your teaching staff, families, and amazing at Shelton. This truly has made us stronger, and our children will benefit. And what keeps us motivated is our children and our families. It keeps us motivated to continue to serve and do the very best. We're going to have additional questions, and they'll swing back to Suzanne.
Did we tell you we miss you? We miss you. Zoom tires us out, but thank heavens we have it. Our children energize us and our families energize us. So we are so hopeful that all of this works out, and we are going to be prepared, that is for sure, to do the best job we can for the safety and health of your child and your family and our staff. So we're very excited about that. We want to end on a high note. Yes, we are building a new campus. We moved out. Our move out was last week. We had 14 trucks arrive on Monday. It took them 6 days, really 5. They told us 6 days. It took them 5 days with the 14 trucks to get everything moved from our Hillcrest campus to our Preston campus. And we are so excited. We are in for a treat. It is going to be a fabulous campus. There is no doubt. Generations to come will benefit from Shelton. We are just going to be so proud. I have to tell you that I want Melanie to feed me some questions now, and let's see if we can answer some for you.
Okay. First of all, there's some questions being asked about the differences because we're now in Collin County and the Dallas County orders. Could you speak to that?
Good question, and we didn't cover it. We will be in Collin County, you're exactly right, and they're very hard to contact. So that answers your question. We have to work with a group that we can contact and get help from, and at this moment in time, it's Dallas County. We are still striving to get connected in partnership with Collin County. At this moment, between our nurse, myself, maybe one of you can help us. The contact has not been very good. They may be overwhelmed. They just may be following what Dallas County has. So I hope that answers your question. But yeah, you're right. Our campus is in Collin County. It could give us definitely some different guidance, but still remember the health and safety of your child and our staff is first.
Okay, the next question is, with these guidelines, are we pursuing an option where there might be an exception for LD students to be on campus?
We're going with every exception we can. Good question. Right now, if you read what came out on Thursday, even for public schools, what it said for public and private, it said that those students that did not have a connection at home, a hotspot, and those students without a device could start September 8th. That is what's giving us hope, because you're exactly right. Our children need to be face-to-face to learn, and yes, we're going that angle.
All right. There's also parents asking about if they could, because our parents want on-campus learning, is there a chance we could provide a waiver and allow them to come on campus?
We'll be signing other forms anyway, so believe me, but good question. We hear you loud and clear, and I'm glad to hear it again, that you'll be signing forms anyway, so whenever we start, but to sign the waiver and just bypass all the county health decisions and all, we're not quite there yet, but believe me, we do have attorneys working with all the private schools to work on this. And for you all to know, I don't think I mentioned it, we have a lobbyist that we all help pay, and all her job is to help private schools in Austin. So that is why I say, as we're talking right now, I think she's working on something that's probably about to be announced in the next couple of days. Who knows? We're still very hopeful.
And Suzanne, just to mention and to thank parents in those questions, they're saying that we are so prepared and we've thought through everything that they're willing to send their kids, just let me sign. So we appreciate that.
We need to hear that, because I tell you, this is, we know we have you as a team, or we would not be doing any of this. And what you've done is incredible. So we hear you loud and clear.
Okay, there's questions about the boot camp and meet the advisor. If families decide to do at-home learning, can they still participate and meet the advisor? And then who is the boot camp for? Which group?
Absolutely, you can. We want you meeting at home. It's more important, truthfully. I mean, we need you to meet the advisor and the teachers. Yes, the answer to that is yes. The boot camp is going to be, it's going to be customized and individualized. Christine and Amy will having another meeting with you to go over those specific details. We realize that is all in the development phase of how that's going to look, because as you realize, we just pivoted to this course of action on Thursday, which we already had planned. However, we're still in the developing exact phase of that part. When we know it all, we'll have a smaller meeting just with you by division.
Okay, will at-home learning be allowed all year?
Yes. Aren't we lucky? We're very fortunate. Yes.
Okay, and then for fifth graders, and this question was also asked about fourth graders, will they be provided with a laptop or Chromebook, or do they need to get their own, fourth and fifth?
At this moment, we do not have a device for our EC through fourth grade. If there is a situation at home where there's not one in the family, we need to know, talk to Amy or talk to Christine. Then we will figure out how we can help. So we're just, it's, as you can imagine, sending all of that home with EC through fourth, we just aren't there yet. But definitely talk with Amy and Christine about that.
All right, now the questions about the new building. First of all, is it finished?
Good question. As you can imagine, our construction crew has not been immune to the virus. And so we've had some start and stops. Now their stops are not as much, I will tell you that. At the beginning, as you can imagine, the entire place was shut down. And of course it's cleaned every time something happens. But now their contact tracing is different than it was at the beginning. But yeah, we went from 300 workers to 150 at a period of time. They say yes. However, you saw on my first slide, construction permitting. We are supposed to get our occupancy situation on August 9th. We're still hoping that is the case. But as you can imagine, if the virus affects our construction crew. You know how y'all have all done projects. I do know that about our parents at Shelton. The last 4 to 5 weeks are critical, and they are making tremendous progress. We're doing our walkthrough tomorrow, believe it or not, for all the academic classrooms. So I have to, yes, they say they will be finished, but let me tell you, we knew it would not all be finished. Our fine arts area is not going to be finished when we move in. They tell us the end of September. In my mind, I say the end of October. So I'm hopeful on the front end, but I have to live that way as executive director. We already have a situation planned for all of our fine arts. We have phase 1 and phase 2 for you all to know. We knew phase 2 was never going to be finished. That's our fine arts auditorium, and that is our field house and all of the outside activity part of our football field. That part was never in phase 1, and also all the things, the beautiful elements that make a campus look gorgeous, those are not in phase 1, and we knew that from the beginning. So to answer your question, the academic classrooms and the part that we need, we are told yes, but we have to realize they're humans and the virus affects them.
Yeah. All right, Suzanne, there's a question. Did we consider postponing the start of school altogether until September 8th and extending into the end of May or June?
We did, and I don't know if you read in the document that's online, we still have until May 28th that we can work with, but we're just so hopeful that 24th, 25th week that we can get our kids started. They need a connection. They've been unconnected since March 12th. The social and emotional part of that bothers us at Shelton, I will tell you. And we want to be connected as soon as we can. That's why we got connected March 13th. I shouldn't say that, March 23rd, the day after spring break. Our teachers worked hard. We realize that emotional part is important for our children to connect with their teachers. So we are still going with this plan, but yes, we could absolutely, that could be another course of action.
Yes. And this question is exactly what we feel. It's asking what steps will be taken to facilitate that rapport between the student and teacher during online learning. If it keeps extending, how will we build that relationship?
Well, I will tell you at this moment, driveway teaching, tents, I don't know if y'all seen the different colleges at this moment, tents around our whole campus with shade to get if we can do small groups so that we can get to know our kids. So we're looking at all of those ways to connect with the child live.
Okay, question about Google Meet and some of the training that Chris Brindell is doing. First of all, does Google Meet require a password to enter?
Chris, I turn to the pros on this.
So Google Meet does not require passwords or accounts. So students that are EC through second who do not, technically they have a Google account, but they are not turned on. So regardless of that, they will still be able to connect to a Google Meet without needing to log in.
Okay. And then Chris, about your training for Google Classroom, a parent said, will that be virtual or in person? And then where do they find the link to sign up for that?
So Google Classroom, all trainings will be remote trainings. We will not have any in person simply because there's not a way to do it safely currently. So all trainings will be remotely. They will be recorded for posterity. But you can go back and review those at any point in time. So the link will be sent out probably from Ann Thomas with a Shelton parent e-post. We will also at some point this week be making this presentation available. And so those links are also included within this presentation.
All right, thank you. There's a question if the windows in the new building, if the windows can open in the classrooms that have windows.
No, they cannot at this moment. And that's for security. So no, but I will tell you this, we've got skylights, we've got light coming in lots of places. But no, our windows, as you can imagine, security reasons and all, when we were building the new campus. So at this moment, no.
Okay, some more questions about masks. Just a parent wanted to confirm what teachers will be wearing in the classroom, shields or masks.
Well, our recommendation is that teachers will be wearing both at times when they're just working and just, doing things, because we've got to protect our staff. There's no doubt. But when they're presenting a lesson so that the kids can see them, because they're going to be further than 10 feet from children, that they would be doing the shields or something where their mouth can be seen.
Okay, then what about cute Shelton masks? Will we have those?
We're going to have some in our store. And yes, Michelle Rivera's already on it. They're already ordered. And yes, we're trying to change our store to online at this moment in time. So absolutely, we'll have Shelton Charger mask. That's my favorite one, I have to say now. But it was personally made by Elena, our cleaning crew. So it's very special to me. I will say that. But yes, we'll have them. But we know they won't be comfortable for everyone, and we don't want everybody to wait and rely on those in case of back orders and things like that.
All right. Also, along that same line, will they be able to buy used uniforms from the store?
Yes, we're developing all those same procedures. Our goal is when we get to have parents back on campus that we'll just spread them out. They can be outside. It's on the honor code anyway. But please know we're very relaxed in the uniform situation this year. We want to lessen anxiety for every family. If for some reason you don't feel comfortable buying something now at Mills, uniform online, we get it. We get it. So totally understand that. We know they say they're supposed to be opening, but we don't know that. That was told to me last week. So that's a last week announcement. But we totally get it. So yes, used uniforms, we're trying to do that. We've got them all someplace.
Okay, the question about will we require uniforms if the kids are learning at home?
Oh, relax. Don't worry about a uniform at home at this point. We will require clothes, and we like shirts. Shorts are no service. I'm joking. You got to have a sense of humor. We saw everything, as you can imagine, EC through 5th. But anyway, we do want clothes. But no, don't worry about the uniform part.
Okay.
But get ready if they change their mind and you come back.
Okay, there's several questions about the schedule for at home and compared to the schedule on campus. Will the schedule at home be the same number of hours? How will those two line up? And will the child have the same teacher if they were to switch back and forth or from one to the other?
Amy or Christine?
Yeah, so we are accounting for the same teacher that if they were present on campus would be their teacher for e-learning at home. And or if we need to pull in a facilitating teacher to manage the e-learning at home, when they do come back into the classroom, they would stay within their cohort. So we're trying to keep it as consistent as possible for the child. So what that really pertains to is if there are typically 12 kids in a cohort, early childhood through 4th grade, 10 for 5th grade. If 3 students in that cohort choose at-home learning, we're not going to fill those 3 spaces on campus with new students. It's like a reserve spot. We're working with them at home, and then they get to come back in and join their cohort. That also enables us to do fun things like we can Zoom lunches together. So if you're at home, we can do a Zoom lunch where you can connect with your friends on campus. I think that's so important for the social, emotional, and this connection piece. For me, that's been trumping everything. I want these kids to have a different life as much as possible than the life that's currently presenting them, which is an at distance or apart connection with others. So to answer that, it will be the same. And then Christine, did you have anything to add?
And regarding schedules, this meeting is early childhood through 5th. Schedules for early childhood through 5th, that's going to be a range of scheduling. So we're going to do that in a more intimate model, so then we can speak specifically to scheduling for the students that you have at Shelton. So that is to come within the next week, and all of that will be out to you before that August 3rd, I believe, where the additional survey will come out to ask again if you're choosing Shelton at home or Shelton on campus. But we want to do that in a more intimate setting with our divisions, so more questions can be asked pertaining to division.
Perfect. And one more question for Christine and Amy. Parents would like to know when their students will know their teacher and whose class they're in.
Absolutely. Well, this time I'm going to say typical to the usual start of school, which is right before those days prior to the start of school. Everything is still very fluid right now with making those cohort groupings. So I know as of today, not ready to publish anything, but I don't see any need to change the model that we've always worked with.
And I second that with Amy. That's the model we've always had. Those classroom lists always come out right before, maybe the day before or the day, before school is out. As always, though, if you have specific concerns or there is particular qualities of a teacher that your children you think would best serve your child, we always listen to those concerns. You can always email us about those. But we're going to stay consistent with our regular way that we have handled classroom lists in the past.
Okay, and I missed one here, Amy, for you, Amy. Question about the therapy, whether it's association or C, and how will that work with the cohorts?
Absolutely. So in the reading therapy, whether you're association or C, your cohort will be able to teach that. We also have a specific to association method. We have an ancillary staff member named Glenn Razor, who specializes in association. Some of you may know her already if you've been with me in 3rd, 4th, or had the opportunity to have her as a lower school student. She's coming into those cohorts once again with contact tracing, so we know exactly how many students she is in front of, and will help keep the association method going in some of those small groups. So this is part of the matrix that we're designing right now as administrators, which is ensuring that the reading therapy continues with the teacher who is the child's cohort advisor.
Perfect. Will they still have library and PE?
Yes, they still will have library, and they still will have PE and plenty of outdoor time. Those PE teachers will be assigned to cohorts again, so it will not be multiple PE teachers with a cohort, and that might be outdoors, and we're going to utilize every bit of space we have on this beautiful new campus.
Okay, Suzanne, this is a question I think for all divisions, and one that's we've talked about a lot, is how do we ensure that this virtual learning is the same as in-person learning, and how will they get the hands-on experience if they're at home?
Well, that's going to be a challenge with hands-on.
Yeah.
They won't have the exact materials to speak of. That doesn't mean that that couldn't change, but that will be a little different. But they'll absolutely get to watch, like for example, fourth grade, they're doing a Texas history lesson and they're working with pecans or something like that. I mean, there's something where we can get organized enough on our end to know there may be some things where our families can help partner with us and help make this situation work to where they have the hands-on whatever they need. Like if we're doing blue bonnets and you have to have some popcorn to make the blue bonnet. I'm just kind of thinking of things, but the Montessori equipment to send it all home, do we have enough for every child to have that? We do not have enough equipment for all that if they're little bitty. That doesn't mean that we can't do some individualized work at times with that, but sending home all the equipment and all the Montessori because we still have a survey August 3rd, so we don't know how many. At this point, there were not that many in EC through 5th. That number was very, very low. If I remember correctly, it was almost 6. I think only 6. There could be some possibilities. If that number grows, then that's a challenge for us, if that makes sense.
Suzanne, if you don't mind, I'd like to interject on the part of EC through 2nd. We took the opportunity this summer to really be creative with multisensory, connecting that distance learning with the multisensory approach. We had a pre-primary and first and second summer school classes. We sent home kits with multisensory materials, not necessarily all Montessori materials, but a range of multisensory materials that the lessons that we were doing, the student could be participating in a multisensory way. That was something that we really spent a lot of time with to make sure that that opportunity was happening. And the same with first and second. We sent home in math, there was a particular Montessori material that we felt was effective. And then we had other multisensory materials that were not Montessori materials, but were materials that really engaged the learner and extended the lesson. So we believe multisensory is important, especially in that early childhood through 2nd. And so that is a part of the plan and something we've thought through. So when those if we have at home, there will be a parent pickup and there will be items that will extend your students' learning online.
It just may not be the exact Montessori equipment that they're seeing at school.
But there's plenty of other things that will extend it and engage it. They'll still have that tactile opportunity. Absolutely.
Okay, there's a question. I'm going to give you 2 at once. One is about what about speech, the speech therapy, and another would be about new students. Are we still going to do new student visits?
Okay, speech, yes, children will continue in speech and language, and we will be figuring that out by cohorts. Absolutely, they'll receive that. It's very, very important to us. And the other question, Melanie?
I lost it. Will we be doing new student visits, and then if a parent has a new student, will they be able to walk them into campus on the first day? And then as we go through the year with potential new students, will we still allow them to visit?
Okay, new families, we're trying to get a tour for all families, and you will be included in that so that you will be with your child. Then we will have to go with what's going on, because so hopefully what works for new families to know, you walk in with them, you see the entire campus, you see everything. So hopefully anxiety is lessened by your child. And then the next day, believe it or not, drop off at Carpool. Now we realize our 3, 4, and 5-year-olds may need some more individualization and customization. So we get that. If there's that concern, just reach out to Christine or Amy and let them know, and we'll figure out what needs to work to benefit your child and lessen anxiety. Our goal is that our tour with parents and our child being a part of that tour will lessen most anxiety with most children. But we get it. It won't for all. New students. We will be, believe it or not, we have been doing so many virtual intakes this summer and enrollment this summer with different families that we've had to stop in some grades. We are here to help as a school. When you need Shelton, you need it today. You don't need it in another year. So guess what? What we figured out for these younger ones, we'll still do the virtual part of everything as we speak today. And then they get to come visit, hopefully, for recess. Wouldn't you like Shelton on an outdoor day at recess? Those are our ways that we're thinking creatively so that we can at least meet the child, meet the family. As we say, that could change. The older a child gets, they may be doing a virtual visit for 3 days because, as you can imagine, Shelton, we have visitors all the time, so we're going to have to curtail that for a little bit, but we need to help children. So we're developing ways that we can still help children, get them admitted, but not before we know all the information about them, before we just mess up our whole cohorts and what we're striving to do. So I hope that makes sense.
Okay, the next questions are health related, and about our policies related to that. First of all, if there's a close contact and my child was in the class that needs to be quarantined, will that child need a negative test to be allowed to re-enter school after 14 days of no symptoms?
Oh, I love
No,
this question.
sorry. Go ahead, Suzanne, if you want.
No, I love this question. Go, Eve.
No, we are not requiring testing to return to school. Again, our advisor on the board, who's a pediatrician, recommended against it. Especially right now with all the issues with testing, it's just too big of a challenge. So we're just going by the time that has been recommended.
Okay, well, are all students going to be tested before starting school?
No, we are not doing that.
Okay, can you clarify why a child will not be required to show a negative test to return? It says best practice in the industry has been 2 negative tests within 24 hours to return to work. Why are we doing the 10-day quarantine versus requiring a negative test?
Again, it wasn't recommended by the pediatrician on our board for a variety of reasons. One, the gold standard test is quite unpleasant. The nasal swab has to go way in the back of the nose. And for our children, we felt that the other measures were safe and adequate. And also right now, the tests are not coming back in a timely manner. So, you know, right now with the surge, it's taking up to 14 days to get a test back.
Okay, and that leads right
So if we wait for a negative test.
And Amy and Melanie, also to answer that question, there could be some offices that are able to do the fast test. The fast test meaning 2 negatives. That child's only been out of Shelton for 3 days, had all the symptoms. Those 2 tests within a 24-hour period are negative. And the reliability of all the testing right now, our medical advisory group did not want us to get in the role of investigating what tests are reliable and what tests aren't. And so erring on the side of caution is they're going to be out the period with the symptoms anyway. And that's better for our entire community versus bringing 2 tests back within 4 days and they're both negative. And it's just, it didn't feel right to any of us.
Got it. Okay, currently it takes a few days to schedule and get an appointment and sometimes to get those results. So how does the child continue to learn while they're waiting on that?
By what we're doing in the classrooms, from the document cameras. That's why we're doing all this. These are going to be symptoms from everything. The document cameras and the MeVo, depending on the age of the child and the individualization and customization of everything.
Right. Okay, my child visits the nurse for a headache. Will they be sent home every time and have to do the whole quarantine thing each time?
Yeah.
Unfortunately, yes. We do realize that lots of our children have allergies.
Uh-oh, she went out.
Allergies. Who, me?
There it goes. You're back.
Sorry. Sorry about that. Unfortunately, at this time, yes. We do realize that a lot of students have headaches for allergies or for other reasons. And I strongly encourage, if your child has allergies, to give medicine at home before they come to school. And again, you know, I apologize for any inconvenience. We just cannot take a chance on having someone who is sick at school. Headache is one of the primary symptoms of COVID. So unfortunately, this year, we're going to be very strict about that.
Okay. Let me go back up here. Eve, could you clarify the part about where if someone tests positive, where that information will be, how parents would know about that?
I don't know exactly where it's going to be, but we are going to create a secure place on our website, and we will send you that information once it's done, so that you can log into your parent portal, and there'll be a quick link, I'm sure.
All right, and then this one is asking about if a student on campus is confirmed that there was a governor's order that the entire school closed for 5 days. I think that may have changed, but what is?
Yes. Good question. That was incorrect information and misquoted from the governor.
Okay.
We will certainly, if we have a positive case, we will certainly do some cleaning, not some cleaning, but significant cleaning of all those areas to make sure that it's safe for the kids to go back.
Okay, the next one is about teachers. What happens if a teacher gets sick, and what are we doing to protect our teachers as far as allowing them to be home or on campus?
We're following all the rules of all the different acts that are in place to help our teachers. I hope that answers. Shelton has always been one that's helped in all situations. So if they're sick, what's interesting is these cameras can be taken home. So and we're also going to be asking our teachers to have lessons prepared so that if the teacher does get sick for any reason, we have lessons already prepared to where we can have another teacher in the room helping make sure it goes okay so that there's no loss in academic time. Did I answer the question?
Yes, and that teachers, will teachers be able to choose whether they work from home or on campus?
Right now, as you can imagine, in any company or any business, all of y'all realize this, that the HR departments are very busy. So there's different people that qualify under the act for the coronavirus, and we're working with all of those people. So thankfully, those people we can put in different roles. So therefore, we have distance learning going on at home. And so some of those teachers will be placed in those roles to make sure all of that is going smoothly and what parents need and what the child needs and all of that. We're going to have different availability for some of those staff members. We're very fortunate because at this moment in time, it's not a lot. The thing that we'll be working with the most is our staff members that have children in other schools that are doing different plans. And we're already developing a plan for that. That will affect schools much more than sometimes the other situations. So we are working with all of those things for our teachers.
Okay, Suzanne, there's a question about, I presume, if it were a new student, how would they be placed in a cohort if we don't have any academic testing yet?
Well, most of our children come with academic testing, and I know some of y'all's are very little, so they haven't come yet with some things. We are hoping that our testing department can get up and running and that we can do some things with those kiddos before we see them. But I will tell you from experience at Shelton and from anything, if we have anything in writing on our children, we pretty much can do a lot with that information. And also the conversation with you as parents and the school that they were in. But our goal is to get the testing done as soon as we can get in the building and work with those students.
Suzanne, I'll speak to that. I know this is similar for Christine, so I'm going to speak for her too. When we did the intake with new families, we were able to access any testing that you had done prior to the child coming to Shelton. For 3rd through 5th grade, there's more testing to access than for a young child. But during that intake time, both Christine Davis and myself were able to articulate what reading therapy program your student will be in the fall. So when it comes to the groupings by reading therapy, that's something that can be done now. Best approach, actually, whenever it comes to deciding where a child starts in each specific reading therapy program is for that trained reading therapy teacher to do a benchmark on that child. With us doing cohorts and we're together all day, we can plan out how the day goes, pretty much, since we're not traveling from class to class. And a teacher can benchmark your child in the C program per se, benchmark this child in the C program, and then be able to make a small group for reading therapy. Although the testing, admissions testing, is valuable because it provides for us a data point with which to monitor progress, it's also useful in confirming the reading therapy. I will say I feel very good about all the reading therapy decisions that I made this year based on the information I had, and I know our teachers are going to do a great job of benchmarking your student and putting them in the right place in the program that I recommended.
Amy, I wanted to tag on that to that. I also know I received specific questions, and I'm hearing questions about new students. We are thrilled about our new students, and we recognize, especially for that young child, that acclimation period and feeling comfortable. And as these different guidelines unfold, we are always going to be thoughtful. As much contact that we can make that's appropriate and safe, we absolutely will do. We're keeping in mind that we do recognize for that new 4-year-old or new 5-year-old who has not visited the campus or met with their teachers, that might need to look a little bit different than another developmental age and stage. So just always know that we're being thoughtful about that. And as information unfolds, we're going to make sure that we have as much appropriate ability to make contact and as possible.
Okay, I realize there are a few other questions in the queue that I'm going to ask either Amy or Christine or the appropriate staff member to get back to you. Some of these are real specific, some we need a little more time on. So, but please know that Chris Brendel assures us that we will have a copy of all these questions, and I've written some down, and we will be in touch to answer your specific questions. They are great questions. And I also want everyone to see all of your positive comments. We appreciate that so much. You don't know how much the positive goes a long way, because we're working so hard on all of these things. So thank you for recognizing and appreciating that.
Absolutely. And thank you for moderating, Melanie. That helped tremendously. And have we told you, we miss you. We thank you. We can't wait to see you. We will continue sending out communication. We know we've been communicating all summer. Guess what? Please stay tuned, because there'll be a lot more as we finish the summer. But we can't say thank you enough to what you're doing. And we want to finish with just a 2-minute, no, it's only 28-second drone picture, thanks to one of our coaches, drone picture of our new campus, so that we can all know that there is hope, and we will be there as soon as we can. We appreciate you. Here it is. There it is. We're excited. Y'all have a great week, and we'll be in communication. Thank you.